Imaging and Comping Policies for Trauma, Portable, Surgical, and Age-Related Radiography by Brandy Jones.
Pediatrics. You will get an individual PEDS practice lab the week before your lab test.
Pediatric lab testing. See your lab manual. It shows which tests will be on the baby phantom and which will be demonstrated as a regular lab test. You will be lab testing on chest, abdomen, upper extremity, and lower extremity. Non-exposure lab tests. Two of the lab tests you must perform are 1. Toddler chest using the Picostat. It will be PA and lateral erect. 2. Infant acute abdominal series using the Tayman board. You will perform AP chest, a KUB, and a left lateral decube. Exposure lab tests. There are 4 exposure lab tests that you must perform. They are number 1, infant chest on the Tayman board, AP supine, and cross table lateral chest. 2, toddler abdominal series. That consists of a KUB and a dorsal decube. 3, an upper extremity, AP, and lateral views. 4, lower extremity, AP, and lateral views. You must pass all PEDS labs prior to imaging and comping. Imaging. You may collect the images on pediatrics once you have passed the test. This year, the test will fall on November 16th, 2021. You may image once all the single labs for PEDS have been completed. Comping. You may comp on PEDS once you have passed all the PEDS labs in lab. And you have imaged first, of course. Pediatrics. Class of 2021 required images. All pediatric exams must be performed on children 0 to 6 years old. For this category, you are required to collect 2 pediatric chests, 1 pediatric abdomen, 1 pediatric upper extremity, 1 pediatric lower extremity, and 1 pediatric portable. Pediatrics for class of 2021 required comps. All pediatric exams must be performed on children 0 to 6 years old for this category, to include pediatric chest, pediatric abdomen, pediatric upper extremity, pediatric lower extremity, and a pediatric portable. Geriatrics. No lab testing on geriatrics. You may collect images and comps right after you pass the test. Imaging. You may collect images on geriatrics once you have passed the test. This year, the test will fall on November 16th, 2021. You may image once you have collected all images. Comping. You may comp test on the geriatric exams as soon as you have collected and imaged with an imager. Geriatrics. Geriatric studies. The patient must be physically or cognitively impaired as a result of aging. Plus, the patient must be 65 years or older. The class of 2021 required images are 1 chest routine, 1 upper extremity, and 1 lower extremity. Geriatrics. Geriatric studies. The patient must be physically or cognitively impaired as a result of aging, plus the patient must be 65 years or older. Class of 2021 required comps. 1 chest routine, 1 upper extremity, and 1 lower extremity. Portables. There is no lab testing on portable radiography at this time. You may collect images and comps right after you pass the test. Imaging. You may collect the images immediately after passing the test. This year, the test will fall on October 12th, 2021. You may image immediately after you collect your portable images. Comping. You may comp test on portable exams as soon as you have imaged with an imager. Portable exams. Class of 2021 required images. 2 portable chests, critical care. That means in the ICU, the CCU, or PACU. The patient must have a line or a tube. 2 portable abdomens. a KUB, 1 portable extremity, orthopedic in nature. Portable exams, class of 2021 required comps, 1 portable chest, critical care, ICU, CCU, PACU. The patient must have a line and/or tube placed. 1 portable abdomen, KUB, and 1 portable extremity, orthopedic in nature. OR exams.
There is no lab testing on surgical radiography at this time.
You may collect images and comps right after you pass the test. Imaging. You may collect images immediately after passing the test. This year, the test will fall on October 12, 2021. You may image immediately after you collect your surgical images. Comping. You may comp tests on the exams as soon as you have imaged with an imager. OR. Class of 2021 required images. 2 C-arm exams and/or cases in the OR. They must include EP and lateral C-arm manipulation. 2 C-arm exams and/or cases in the OR with any manipulation. OR. Class of 2021 required comps. 1 C-arm exam and/or case in the OR. Must include AP and lateral C-arm manipulation. 1 C-arm exam and/or case in the OR with any manipulation.
Trauma exams. Lab testing on trauma.
There are trauma extremities to image in comp. 1 image and 1 comp for each. Upper extremity. 1 trauma shoulder/humerus. It's a minimum of 2 views. For the shoulder, 1 view has to include the transthoracic Y and/or axial. 1 trauma upper. This should be a non-shoulder study, minimum of 2 views at 90 degrees to each other, not a standard routine view. However, you do not have to wait until learning trauma to image and comp these studies. You are eligible when you have learned your uppers and lowers. There are trauma extremities to image and comp. 1 image and 1 comp each. Lower extremity. 1 trauma hip, which includes an OR lateral with a pelvis. Minimum of 2 views, must have a pelvis, and must have an OR lateral trauma hip. 1 trauma lower extremity. This should be a non-hip study. It should be a minimum of 2 views at 90 degrees to each other, not standard routine views. So maybe an AP or a cross-table lateral. So you do not have to wait until learning these in trauma to image and comp these studies. You were already eligible when you learned your upper and lowers.
You will get an individual trauma practice lab 1 week before you start lab testing.
Trauma rules. This can be found in your lab manual. Students will be given the opportunity to choose blindly from several scenarios in each trauma round. Each scenario contains 5 exams. There are 3 trauma rounds. The patient is to be manipulated in the supine position only. The patient may not be placed prone or erect. All other lab rules will apply. Students have 1 hour to complete the trauma lab in all 3 trauma rounds. The first 15 minutes should be utilized to prep the room and write down the scenario on a blank piece of paper. The scenario should be put in logical order. The paper may be kept behind the control panel at all times during the trauma exams for reference. The next 45 minutes are to be used to complete the trauma exam. Students will need to state that they are removing all articles of clothing, jewelry, and/or objects. Perform the exam in a logical order. For example, all cross-table laterals first, then AP views, and so on. For cervical spines, they will need to have the collar cleared. An additional swimmer view will be required. For hip routine, there is an AP pelvis and a Clemens Nakayama lateral. For the femur, you must perform a Clemens Nakayama lateral for the proximal portion. Use breathing techniques for lateral sternum and T-spine. Mark, measure, and shield. Choose appropriate techniques, screen versus grid. Be prepared to review your images in round 3. Your partner may assist you. Some trauma round specifics. Minimal movement of the patient for round 1. Round 2, there's no movement of the patient. And round 3, there's no movement of the patient because you're performing them on a phantom, Lamangelo and or Pixie. Please refer to your trauma views posted in Brightspace. It is a document labeled Trauma Views.
Good luck, you're almost done.